Hello and welcome to this recorded presentation for the employees of CDM Technology of Michigan for the Employee Benefits Program January 1st, 2023 through December 31st, 2023. My name is Bill Hammett. I am proud to be your insurance broker. Our team is here to help you with making decisions on plans, understanding benefits, help with claims throughout the year, finding ID cards, finding doctors, all the different things that could cause you questions or concerns throughout the year on your benefit plan. We're here and happy to help. Please reach out to us if we can be of assistance. This meeting, we're going to talk a little bit about the timeline of open enrollment, the medical plans available, dental and vision plans, how do you enroll, and then where do you go with questions. Of course, this slide here is going to give you our information. So if you have questions, we'd be happy to help. So open enrollment is from December 1st through December 12th. This is the annual election period where you are free to make any changes to your plan. You can add new people to your plan. You can change from one plan to the next. If you didn't add dental last year, but you want it this year, this is your time to do so. So this is the time where you can do anything you want. For those of you that are declining coverage, it is mandatory for you to go into the system and decline coverage. For those of you that are already enrolled and wish to keep everything the same, it's mandatory for you to go into the system and click through and confirm those benefit elections. So we need everybody to do something this period. Any changes you make will be effective January 1st of 2023, and we're asking everybody to be finished by Monday, December 12th, and you'll complete your applications online at the Ease Enrollment portal. So let's talk about our benefits. We have 3 PPO plans available. The bronze, silver, and gold plan. We'll talk about those just now, all from United Healthcare. The 3 plans kind of hit a lot of different price points and are good plans for different people in different places in their life. The bronze PPO plan is going to be the lowest cost plan available to you and really is a good plan for anybody that just wants a health plan in case of the catastrophic event. This has a high deductible of $7,500 and literally every benefit for the entire year. Everything you could do, you have to pay for 100% until you get to $7,500. So yes, it's a very inexpensive plan, but it does ask you to pay a lot out of your own pocket when you access care. As opposed to the silver plan, much lower deductible in $1,950, so just under $2,000. We have copays for doctor visits, $55 for regular doctor, $95 for specialist, deductible waived. Wherever you see this DED waived, it means you get these benefits without having to meet this $1,950 deductible. All right, so doctor visits, all the way down here to what is physical therapy, occupational therapy, speech therapy, $55 deductible waived. Chiro is deductible waived. And then all the way at the bottom, we have an urgent care visit benefit that's deductible waived. Everything else, other than, of course, prescription drugs, everything else will require you to pay 100% of the cost for the first $1,950, and then you get your benefits. So keep in mind, this $1,950, just like this out-of-pocket maximum, this is a rolling number. So if I go to get an x-ray that costs $100, then I only have $1,850 left of my deductible. If later on I go get an MRI for $400, now I only have $1,450 left of my deductible. All right. So this is a rolling number that you're chipping away at when you get any of these benefits that are after deductible. The benefits that are deductible waived, they don't go towards your deductible, but they do go towards your out-of-pocket maximum. The out-of-pocket maximum is an important number because this is the number at which the insurance company pays 100% of all expenses for the rest of the calendar year. That's important. That is a lot of what you're paying for in your healthcare premium is this deal you make with them that says, after this certain number, you pay everything else and we pay nothing else. So let's give you an example of what that would look like and maybe a major expense. We'll just say I'm on this silver plan here and I have a hospital stay for several days and it's $100,000 in claims. I would pay, let's say I haven't had any MRIs, any visits, any x-rays, nothing. So I have my full deductible. I would pay 100% of the cost for the first $1,950. Then I pay 40% of the cost. United Healthcare pays 60% of the cost. Plus I have this little $250 per occurrence copay, which is stupid, but goes towards your max and your deductible. once I spent 100% of the 1950, then 40%. United Healthcare pays 60%. Once my total out-of-pocket costs for everything, including a doctor visit, including a generic drug, including an urgent care visit, throughout the year equals $9,100, then United Healthcare pays 100% of the cost for all expenses for the rest of the calendar year. All right. So again, even if I have a $100,000 claim and I pay 40% of the cost, my 40% stops once my 40% plus my 1950 equals 9,100. This 1950 is included in this $9,100. Okay. So once you hit that number, you don't pay for doctor visits, you don't pay for hospital stays, you don't pay for prescription drugs, nothing. The rest of the calendar year, it's covered 100%. For the gold plan, you see this deductible is much lower at $500. The out-of-pocket's lower at $8,500. The copays are lower. The percentages you'd be asked to pay are lower. So for the gold plan, for those of you that know you're going to have healthcare expenses, maybe you're having a baby, maybe you have a surgery coming up, it might behoove you to pay a little bit more out of your check, which is pre-tax, to buy a better health plan so that you are out of pocket less money when you use your health plan. Okay. So again, there's a $1,450 difference in deductible right off the bat. So that is a big difference. And I would imagine that your premium for the year is probably less than that number, the difference in that. Okay. So those are our three plans. Our bronze is great for those of you that don't have any desire, or don't have any need to use your health plan, just want something cheap that can protect you in case a major event happens. The silver plan is a really good value PPO plan for those of you that want benefits to be there, like doctor visits, prescription drugs, urgent care, but don't want to pay a ton of money. And then you got the gold plan, which has got the best benefits available and will be a great plan for those of you that are going to have a baby or have surgery or have a lot of MRIs or whatever it may be. So those are our three plans that we have. Here's a little plug to use the United Healthcare app. The smartphone app is the #1 thing you can do to improve your healthcare experience. On this app, you'll find your ID card. You'll find the ability to look up doctors. You'll find the ability to understand your benefits better. You can see your claims. You can communicate with providers 24/7. Lots and lots of things you can do with this app. It will definitely improve your experiences. Please, at your earliest convenience, download this. Some of the added value benefits that are with United Healthcare I want to share. There's an EAP plan, which is known as an Employee Assistance Program. This is a great first step in any kind of mental health journey that you might be trying to embark upon. When you're looking for help on these kind of things, it's really tough to know where to start. This is a really fantastic place to start, a great added value benefit. If you're having issues with anxiety, depression, work-life balance, maybe there's marital issues, drug or alcohol issues, or maybe dealing with elder care, your parents or grandparents need help with finding a place to be taken care of in their later years. This EAP program is outside of your employer, and it is a really wonderful place to start for those of us that have certain things in our life that are difficult to deal with and we want some help. So that's an important option for you there. Please dial that number there at the bottom of the screen if you need anything. Really great service here with United Healthcare. Also, they got a couple of fitness programs. They have the Apple Fitness Plus app, which they'll pay for. United Healthcare pays for a year. So you'll just go to uhc.com/apple-fitness-plus to register for that. Really nice little extra benefit for those of you that are working out from an app, which many people are now doing because ever since COVID, a lot of us had to get our workouts at home. So really wonderful option here for you. There's also the One Pass program, which allows you, there's multiple tiers of membership. Each tier you go up, you get access to more gyms and the stretch labs and the 24-hour fitness and all these different places, LA Fitness, a lot of cool places you can go to get a workout in. So the One Pass system is really nice as well. Good added value benefit, something that's included in the plans that you're enrolling in. So let's talk about our dental plan. We have our PPO dental plan. It's got a $2,000 per year calendar maximum. Now, these maximums with dental PPO plans work different than with medical plans. Remember with medical plans, I said once you reach this maximum number, you pay nothing else and the insurance company pays 100%. Well, with dental plans, it's the exact opposite. With dental plans, once they have paid out $2,000 in benefits for you, then they pay no more and you pay everything else. So that's important to note, $2,000 a year max. This plan has 100% coverage for 2 oral evaluation exams and cleanings per year. You'll see all those other benefits that are covered at 100% for preventative services. Then you get into basic dental services that are all covered at 80%, meaning you only pay 20%. Okay, so we've got root canals, endodontics, periodontics, deep cleaning, scaling, root planning, all covered at 80%. And then some of your major issues like inlays, onlays, crowns, it covers 50%. You pay 50%. And again, once United Healthcare has paid $2,000, then they pay no more for the year. Okay. Important to note, this is $2,000 per person in your family. So if it's me, my wife, and 2 kids, then that's 4 $2,000 maximum benefits. So about our vision plan, we've got our One Vision plan from United Healthcare as well. You get a $15 eye exam once every 12 months. You get new lenses for a $30 copay once every 12 months. And you get every 2 years a $150 allowance for frames. So that's nice. Those are good benefits. And then if you need elective contact lenses, there's a $125 allowance towards that as well. So here's your vision plan. So if you need vision, this is a good one. If you don't need it, you're welcome to decline this coverage. So let's talk about enrolling. You all are going to receive an email that looks just like this. It's going to ask you to log in. You're going to see a little green button here at the bottom of the email that gives you the opportunity to log in. Once you do that, you'll be taken to this screen, which is cdmtech.ease.com. You'll log in. You'll put your password in. If you've forgotten your password, there's a little forgot password button right there. For those of you that have never been in this system, you're going to need to create a password. Once you get into the system, it's going to ask you for your demographic information in the profile portion, what's your address, social security number, date of birth, phone numbers, all that stuff. It's going to ask you the same information for your dependents. If you have any dependents, I recommend that you list them in this section. It does not enroll them in the benefits. You'll have a chance later on to choose to enroll or not enroll these dependents, but you want to list them there so that you have the ability to see what the prices are. Once you get through that, it's going to ask you if you are a part of Medicare. If not, you'll skip right through there. And then you'll get to the benefit page, which if you've been to through this system before, it will automatically default to what you did before, which is enrolled or waived. But if you've never been in this system, you're going to want to see there's a check mark here and an X. It's all going to be gray if you've never been in the system. Before you can get scroll down the page and see the different plans and have these buttons that allow you to select the plan, you need to hit the check mark, which indicates that you would like to enroll or you'd like to just see what the prices are. Again, you have the ability to come back here and hit the X button, which indicates you wish to decline coverage. Not a problem. You can toggle between the two very, very quickly, very easily, but you must do something here for anything to happen below. All right, so hit the check mark to say you would like to enroll. You'll see the different options that are available to you. You'll see links underneath the plan that you can click on and get more information on. Once you hit one of these buttons, it'll put a big green square around or rectangle around your choice, and it will tell you your per pay period cost. This is your number after your employer pays their portion, and you can see the prices are tallying up on the right side. So once you get through the medical, dental, and vision, you'll be able to see all these prices. You'll see your total per pay period amount. All of that is available to you, and if you have dependents, you can quickly check or hit the check mark or X very quickly, and you'll see these numbers change instantly on the side. So please do that. Also to note, if you hit the X, it's going to ask you why you're declining. Do your best from that drop-down menu to give us a reason why you're declining. Anything is acceptable, including the last option, which is other, and you can fill in the blank saying none of your business. No problem. If you've got coverage elsewhere, go ahead and enter it. If not, we understand. We just want to know that you're declining and if there is a reason. You'll follow the same process for the dental and vision benefits. Once you're through there, you'll be brought to the benefits summary page, which will allow you to see how you enrolled, what you chose. If these are correct or incorrect, you can go back by clicking any one of these documents here, links here, and you can update it. Otherwise, you hit this continue button. It'll take you to an area that's asking you to sign your forms. You'll hit the sign forms button. You will type your signature. You will write your signature with either your mouse or with your finger on a mobile device. You'll hit next. It'll take you through the entire the entire application and allow you to insert your signature wherever it needs it. You'll just keep clicking through there. Once you're done, it'll scroll quickly back to the top. You'll see a finish signing button at the top right of your page. You'll hit that. Once you do that, you'll get an email that says, thank you for submitting your benefit elections, and you're all done. You can close out of the system and you're done. So what's next? Be on the lookout for that EASE invitation. It's going to come through your email. The deadline to enroll is Monday, December 12th. If you have any questions or you need any answers, we'd be more than happy to help. We are here. We are here to help, and we are proud to be your insurance broker. Thank you for your time and listening to this presentation, and reach out to us if we can assist you in any way. Thank you so much.